Normal sinus rhythm in reality is the only normal rhythm. When you ask the question in the 5 steps approach, the answer you derive will be and must be within normal limits in order for you to acknowledge that the rhythm you are analyzing is indeed a normal sinus rhythm. So the rate is between 60 to 100 beats per minute. What is the rhythm? Atrial rhythm is regular. Ventricular rhythm is regular. Is there a P wave before QRS? Yes. Are the P waves upright and uniform? Yes. What is the length of the PR interval? Between 0.12 to 0.20 seconds, or 3 to 5 small squares. Do all the QRS complexes look alike? Yes. What is the length of the QRS complexes? Less than 0.12 seconds or 3 small squares. Sinus bradycardia may cause by intrinsic disease of the SA node, vomiting, electrolyte imbalances, hypoxia, hypothermia, or the effect of certain drugs, such as morphine, digitalis, beta blockers, calcium channel blockers, and some sedatives. Do we panic when we note a sinus bradycardia on a rhythm strip? No, we don't panic over any rhythm. We simply consider the ramifications of that rhythm based on your patient's clinical condition. As a matter of fact, in a person who is sleeping and in a young, well-conditioned athlete, we expect to see some degrees of sinus bradycardia as a normal phenomenon. You should note the heart rate as 40 beats per minute. The rhythm is regular, P wave is present and upright, the PRI is 0.16 seconds, and the QRS is 0.06 seconds, and this finding should validate sinus bradycardia. Remember that sinus bradycardia looks very much like normal sinus rhythm, but the rate is slower, less than 60 beats per minute. Always remember to monitor your patient's clinical condition. Sinus tachycardia is the other first cousin of normal sinus rhythm. Tachycardia technically means a fast heart rate, and the term sinus tells us that this rhythm originated in the SA node. Thus, we can conclude that sinus tachycardia is a variant of normal sinus rhythm. The only difference being the rate of the impulse generated by the SA node. The rate of sinus tachycardia or sinus tach is generally considered to be 100 to 160 beats per minute. The impulses generated in this rhythm follows the normal pathway of the electrical conduction system. Thus, P wave will be presented before QRS complexes. The PR interval will be within normal limits, and the QRS complexes will all look similar and will be less than 0.12 seconds in length. The atrial and ventricular rhythms will be regular. As the heart rate approaches the upper limits of the normal range, the P waves may be slightly harder to discern, but they can usually be observed and analyzed. Causes of sinus tachycardia are numerous, including exercise, fear, stress, pain, anxiety, and indigestion of stimulants such as coffee or alcohol, all of which result in the stimulation of the SA node. Sinus dysrythmia resembles other sinus rhythms, except for the slight irregularity of the heart rhythm. The rate of impulse formation in the SA node may vary with respirations. In this rhythm, impulses are initiated by the SA node but at irregular intervals. An irregular rhythm is produced when the P to P intervals and the R to R intervals change with respirations. In sinus dysrhythmia, the heart rate increases during inspiration and decreases during expiration, related to changes in intrathoracic pressure. As a general rule, there should be a difference of at least 0.08 seconds between the shortest and the longest R2R intervals in order to determine that the rhythm is not a normal sinus rhythm. A very careful step-by-step approach is necessary to distinguish sinus dysrhythmia. Sinus dysrhythmia is a common and normal finding, especially in children and young adults. Causes of sinus dysrhythmia may include the administration of certain drugs, such as digitalis, underlying cardiac disease, such as sick sinus rhythm or myocardial infarction. Remember that the key to identifying this rhythm properly is the heart rhythm. You should note that the heart rate as 90 beats per minute, the rhythm is irregular, P wave is present and upright, the PRI is 0.16 seconds, and the QRS is 0.04 seconds. This finding should validate sinus dysrhythmia. Sinus arrest rhythm. When the SA node fails to initiate an impulse, a rhythm known as a sinus rhythm results. When the sinus node fails to discharge, the absence of a PQRS-T interval is noted on the strip. This occurrence causes a slight period of cardiac standstill, which lasts until the sinus node continues its normal function. The absence of a PQRST complex appears as a pause on the EKG strip. This rhythm can quickly get your attention. However, if these occurrences are infrequent, there may be no immediate cause for undue concern. Patient assessment is imperative. Causes of sinus arrest may include hypoxia, ischemia, damage to the SA node, or certain drugs such as digitalis or salicylates. Sinus arrest can also occur as a result of MI. Remember that the key to properly identifying this rhythm is the transient absence of the PQRST complexes. You should note that the heart rate is 54 beats per minute. The rhythm is irregular. P wave is present and upright. PRI is 0.16 seconds and the QRS is 0.06 seconds. These findings should validate sinus arrest. Remember that sinus arrest presents as an infrequent absence of a PQRST complex. Remember, always monitor your patient's clinical condition.